Okay. So it's just to say kind of welcome to everyone. We're hosting this methodology seminar on the results of the sexual violence survey, as it's a particularly complex survey. It's a very sensitive survey, obviously, and we just felt it would be good to take an opportunity to go through some of the quite complex concepts behind this particular survey. Keith McSweeney is my name, and I'm your host here today. I'm joined here by Helen McGrath and Dr. Jessica Coyne, who will be leading our kind of presentation. Just a few housekeeping areas, please. The presentation element of this session is going to be video kind of recorded, but that the question and answer session afterwards kind of won't be. For the duration of the presentation, cameras and mics are going to be kind of muted, but we will turn them back on after the PowerPoint presentation. As questions arise to you during the presentation, please feel free to use the chat function, and after the presentation is over, I will come back to the podium and I will go through those questions. If there's other questions, then we're happy to take those in a verbal sense. So with that, I'll pass to Helen, who will start our presentation here.
Thanks, Keith. So, hi everyone. So today I'm just going to go down through a few elements. Background, methodology of the survey, some considerations on comparability. I'm going to summarise and I'm going to touch on the publication plan for the survey as well. And just, I suppose, just to outline what my job here today is. My job here is to give you the tools so that when you see the data on Wednesday, that you'll be able to kind of engage with it quickly. There's a lot of complex areas, as Keith already mentioned. It's a difficult topic and it's hard to get your head around it sometimes if you're not dealing with it day in and day out. So we're just hoping to perhaps give you a little bit of clarity on the types of definitions we used, on the methodology we used, and why that might have some implications for the data, and then touching on those considerations on comparability as well. So look, we're just going to kick off with the background as to where this came from. So the scoping group on sexual violence data in 2018 published a report, a very comprehensive and interesting report. And one of the key recommendations from this was that a comprehensive national survey on the prevalence of sexual violence should be undertaken. And just to underline that point there about prevalence, this is a prevalence survey, so not an incidence survey. So this isn't a detailed list of every experience that someone has experienced within their lifetime. We were looking at the kind of prevalence, so whether or not someone had experienced it over their lifetime. In addition to the recommendation, they also provided a very large data point list, very comprehensive kind of outline of the data needs and requirements for a survey like this. So the CSO was asked to deliver the survey, and the memorandum of understanding was signed in January 2019. So this is quite something. This is official statistics, what we'll be publishing on Wednesday, but it's also embedded in the work plan to be repeated in 10 years' time. So not only have we delivering, I suppose, the data to answer these questions on the prevalence of sexual violence, but we are also committing to repeat it again in 10 years' time. So before, I suppose, I go into a little bit more on what we did and how we did it, I just want to touch on the definition of sexual violence that we've used in the survey. So this is defined as a range of non-consensual experiences, from non-contact experiences to non-consensual sexual intercourse. And this is based on national and international research. And I suppose just to touch on that, when we talk about violence, what it can mean. So often people may interpret it as meaning with force, but it can also be interpreted as having a marked or powerful effect on someone. So when we talk about sexual violence in our survey, we're talking about a broad spectrum of experiences. We're talking about non-contact experiences to contact experiences. So it would include, for example, a teenager persuading a friend to watch a video when they didn't want to see it, to something like, a man being threatened in order to have sex with him, or someone who had sex while they were asleep. So it's a very broad definition, and it's not something that's we talk about in our day-to-day lives. It's not something hopefully we don't talk about in our day-to-day lives, but it's not something that we talk about openly and freely. These are things that you wouldn't necessarily talk about with your friends, your family, not even your health professionals as well. You wouldn't often talk about this with your GP. So this is quite something to be capturing data upon this. And I suppose one of the big lessons for me when I came to this was, and this is why I'm sharing this slide in particular, is that the true prevalence of sexual violence is at a particular level. But when we go to collect survey data, it's very likely to be underreporting that level of sexual violence within the community. Because of all those issues in terms of, how sensitive a topic it is, in terms of, the fear that someone might have when they're actually describing these experiences, and their own coping mechanisms and minimization that they may be, employing as in their day-to-day lives. So our survey data is likely to underreport the actual prevalence of sexual violence in Ireland. But that's then our job to try and ensure that we put in as many mechanisms as possible to try and capture as close as possible the actual prevalence in Ireland. So I'll talk about how we do that a little bit later on in the presentation. And just, I suppose, again, to underline, I suppose, that last point within that slide there in terms of reported violence, we have data sets across Ireland that do have information on sexual violence experiences. SATU, the Sexual Assault Treatment Unit, have some very good data sets, as well as RCNI, and obviously DRCC published their annual statistics in terms of engagement with their helpline. So, and as well as that, you obviously have Pulse and the courts data as well. So there are pieces of information on sexual violence across, I suppose, our system across Ireland. But for our survey, what we've tried to do is capture as best as possible, as close as possible to the truest level of sexual violence in Ireland. So just to, I suppose, outline just a few key observations. So surveys on sexual violence only are few. It's not common that people have a specific survey on sexual violence because it's such a sensitive topic. And as I mentioned already, underreporting something that has to be managed throughout the survey. Another element, I suppose, for our survey, and just to be aware of it, is that we focused on one type of violence. So sexual violence is part of a spectrum of experiences from, for example, for gender-based violence, for domestic violence, and other types of interpersonal violence as well. So in order to, I suppose, improve clarity for respondents, we went with one type of violence throughout the survey, so to reduce the burden of comprehension and to help in terms of shortening the survey as well. Just to be aware of as well that coping mechanisms and like minimization of experiences can lead to a lack of naming and awareness of experiences, and that's something we also had to manage throughout the survey as well. I'll talk about how we managed that later on in the presentation. How questions are asked can impact disclosure rates in the survey. So research shows that if an interviewer is asking you questions, you will get a different rate than if you were answering the questions yourself. And a final point just to be aware of, that society's awareness of violence generally can also impact on the reported or disclosed levels of violence in society. So how open, a concept this is across a society may mean that people feel more comfortable with identifying their experiences as being part of the spectrum of sexual violence, and also that they'd be more comfortable in actually telling other people about their experiences as well. So that's just something to be aware of as we're talking and thinking about sexual violence generally. I suppose so. As you can see, it's very sensitive, and the CSO, while we do surveys day in, day out about a lot of sensitive material as well, in terms of people's deprivation levels, in terms of their own health status, and what have you. We felt that with this survey there would need to be an additional layer to really sort of drill down as to our ethical responsibilities for the survey. Now, we looked at this both on a comparative basis and a kind of a principled basis to see how we could best meet our kind of ethical responsibilities. So looking at it on a comparative basis, we looked at what previous surveys had done in Ireland. We'd looked at what other international surveys had done, and to see where the gaps were in our proposed approach. And in addition, we looked at what other principles we could use. So we went with the World Health Organization's publication on putting women first, the ethical and safety recommendations for research on domestic violence against women. So while not necessarily focused specifically on sexual violence, a very related topic and that we could use. Now, I'm not going to go down through the 8 principles that they outlined, but this was our framework that we used in order to kind of challenge ourselves to actually deliver a survey that met these principles. But also we actually constituted Social Statistics Ethics Advisory Group as well within the office to take a look at this survey and other types of surveys which talk about sensitive issues, and that might need that additional ethical oversight on that. So I suppose just looking at maybe two of those points in a little bit more detail. So in terms of the first one, the safety of the respondents and the research team, that is paramount and should guide all project decisions. And I'm also going to touch on the fifth point there. The study design must include a number of actions aimed at reducing any possible distress caused to the participants of the research. So just looking at the first point, safety was paramount, and we really tried to look at it from every angle, not just the respondents, but also our field staff who would be engaged in actually collecting the information, and as well as our own staff within the office as well. But looking specifically at the kind of issues around the respondent. So our choice of modes, so looking at how we would actually collect that information, we had kind of decided that it would be a self-completion approach to try and reduce that element of underreporting. So we went with online self-completion on a tablet or on paper, and Jess will talk a little bit more detail about how that operated. But in terms of our choice of modes, having these options allowed people to actually kind of engage in a place and a time that suited them, that they could choose their own setting where they would be able to monitor their own privacy and have their own space to actually go and engage with the survey in a time that suited them. In terms of the choice of completion approach, using self-completion, this meant that there was no one with them while they were completing the survey, so that they could, again, I suppose, maintain their privacy when they're sharing this very sensitive information. The choice of frame we used, which was a person-based frame, meant that we were able to directly identify people in advance of sending out the letters, so that we could offer that invite to a person without having to go through a household instead. We had single-use access codes throughout the survey, so that you could only enter the survey once, and this was to reduce the risk of anyone else using the codes to go and enter into the survey to go and see what data may have been already submitted. We had a unidirectional flow through the survey, so that meant once you started, you had to move through the survey. And again, this was put in place to reduce the risk of anyone joining on to the survey when you were halfway through and then going back to see what was entered. Also, one of our core values within the office is confidentiality, and that is paramount for any of our surveys, that we ensure that people are not identifiable from within the data. And also a framing of our surveys, how we introduce it. We use a neutral name, but the introductory material highlighted the very important aspects, like that these were going to be sensitive questions, that you should only complete the survey when your privacy is assured, that you're on your own, that the confidentiality of the data that you submit is maintained, and that the respondent was very clearly aware of the survey topic when they answered or they accessed the web survey. So these are ways that we try to manage, I suppose, safety for respondents. And then in terms of managing distress for respondents, again, this idea of informed consent, that the respondent is clear that this is going to be a survey on sexual violence before beginning, and that they're made aware of their rights in terms of, informed consent, and GDPR rights are outlined in transparency notice, which was provided as part of the start of the web survey. That we had employed, I suppose, good practice in questionnaire design. So we tried, in as much as possible, to design questions that would not only focus on getting high quality data, but also reduce any potential distress for respondents. So trying to use clear language, trying to use very simple questions where possible, and testing those questions as well to make sure they actually did work. So we did a significant amount of work in terms of working with both service providers and also with survivors of sexual violence as well. We also had an expert review on the impact of the questions. So we had, clinical psychologists take a look at the questions. We had an expert in trauma. We had speech and language therapists take a look at, the questions and the language around it as well. So in every way, we tried to limit, I suppose, the impact on respondents. During the survey, the respondents were informed that they could terminate the survey at any time. They could stop at any point that they wished. They could also skip any questions that they did not wish in the violence modules as well. And a screen with key support services was provided to respondents, irrespective of the responses given. So whether they had shared experience of sexual violence within the survey or not, key support services were provided at the end, but also at the start as well. If someone decided they didn't want to engage with the survey, they would see the helpline information there as well. So I'm just going to talk now a little bit about the design of the survey and I suppose where we began with it and the work we put into since 2019 to get to our data, which we'll be publishing on Wednesday. So just I suppose to outline, we've looking at this, CSO do surveys day in and day out, it's their bread and butter, but this particular topic, we didn't have that much expertise specifically on it. So we did have to go and build up that. And the way we went around that is taking a look at what other international agencies were doing and what other countries were doing. So we met with these people here, Sylvia Walby, Liz Kelly, and as well as the Italian Statistics Office as well, who conduct their own Violence Against Women survey to get to see how National Statistical Institute operate these surveys, and as well as that Hannah McGee, who was the author of the previous survey, Savvy's Sexual Abuse and Violence in Ireland report from 2002. She very kindly gave us her time as well in terms of explaining, I suppose, the background to the survey that she conducted and the kinds of learnings that she got from it. As well as that, we were also a member of the Eurostat Task Force on the Development of European Gender-Based Violence Survey. So this is looking at a broader spectrum of experiences, including physical, psychological, financial, domestic, as well as sexual violence. But we were able to get a sense of how they were approaching it, the kind of methodologies they were proposing for other European countries, and we were able to incorporate those learnings into our design as well. And not only that, as we started off the project and as we progressed through as well, we engaged with stakeholders with experience in the topic as well through our liaison group. So here we had, representatives from Dublin Rape Crisis Centre, from Rape Crisis Network Ireland, from SATU, Sexual Assault Treatment Unit, from TUSLA, Department of Justice. So we had key stakeholders to help guide us as we were moving through and making key decisions on the project as well. And I suppose one of the first things we had to decide was how we were going to address this underreporting risk. And I suppose just to outline just how significant an underreporting risk can be at times, I suppose biases introduced through underreporting of instances of sexual violence will far exceed all other forms of survey and sampling errors. I mean, this is because, as I mentioned already, it's not part of our everyday conversation. Those who have experienced sexual violence, their feelings maybe of shame, fear and panic. And that fear of disclosure, means that, I suppose, that privacy, that security of the setting where you're being interviewed is critical as well. So how we try to address underreporting, well, I suppose government came to us to go and deliver the survey. We are independent. We have high levels of public trust, and that in a way is one mechanism in terms of trying to address underreporting. But we also try to use a mode that created a safe environment to disclose these very sensitive experiences with your privacy and security ensured. Another way that we try to address underreporting is actually trying to break down the concept of sexual violence as well to make it more understandable for people. What we did learn from our Italian colleagues was that people don't necessarily think of their current partner when they are actually answering these types of questions. So breaking down the sexual violence concept, particularly in adulthood, into partner and non-partner can help in terms of priming people and getting them to remember some of the experiences that they may have gone through. And also ways that we try to address underreporting was also using best practice in the questionnaire design as well. So we'd no victim blaming within the questions as far as possible so that no one would feel re-traumatized by being asked these questions. That the questions were sensitively phrased. We try to use clear language and simple language. The grading of the topics from less sensitive to more sensitive through the survey would also help, that you were getting slowly acclimatized to the more sensitive and more private questions as you move through the survey. We also had grading of experiences through the question flow. So as you move through from, let's say, harassment to adult experiences to child experiences, you were also then focused in on perhaps less invasive experiences to the most invasive of experiences throughout those modules as well. We also had behavioural styles of questions. What that means is there were behaviourally specific questions. So these were questions that directly asked you, did this happen? And by clearly defining what this is, rather than asking people, slightly more generic questions or relying on their own self-assessment, their own perceptions of what a term might be. And then we had significant testing of the questions prior going into the field. And I'll touch on that now in a further slide. So I suppose as part of that under reporting and the mode that we use, which was self-completion, we had to be very aware of the fact that we had to have, a reasonably short survey to try and ensure that people will actually engage with it and continue it to the end, and to reduce respondent burden generally as well. So we had to put a lot of work into the refinement of the data point list. So that's the list that I mentioned previously from the scoping group report in 2018. So that list, we use data experts and policy experts to go and help us try and prioritise, to help work on the definitions of what was being asked within these questions, and also to try and tease out, what was really needed behind it all. We created our draft variable list, and then we moved into our liaison group, who gave us advice and feedback on the draft variable list, and that then created our final variable list for testing. So in terms of, I suppose, testing and what we did for the project, so looking at each element within the survey in terms of the variables, the questions, and moving down to the questionnaire in full and survey management, we've tested it at every stage. So in terms of the variables, we went through our expert groups, both data and policy, and the liaison group, as I've already outlined. After the variables were agreed, we then designed our questions. And those questions then were tested with focus groups, where we tried to tease out the understanding of the concepts and the phrasing of the questions, to try and ensure they were capturing what they should have been capturing, and cognitive interviewing as well. For the cognitive interviewing, we had a far more detailed one-on-one interview with participants to try and really tease down into what people understood by various concepts and whether our questions would actually work. As part of our cognitive interviewing, we interviewed people within the office, which is our normal standard practice, for non-sensitive questions. And for those sensitive questions then, we were supported by service providers, and we were able to really tease out the understanding of the sensitive questions. For the focus group work, we had both service providers, and also we were facilitated by Dublin Rape Crisis Centre to engage a group of survivors of sexual violence to, again, try and tease out for someone who's had lived experience how they would understand these questions and whether or not they would work. For the questionnaire modules and the full questionnaire, we shared these, as I mentioned already, to clinical psychologists, experts in trauma, and speech and language therapists, to try and ensure that the burden of the entire questionnaire or the specific module wasn't overly burdensome, and also that the language was clear. Our questionnaire in full was reviewed both internally with experts within CSO who have had a wealth of experience of designing surveys, but also through our survivor review, which we ran over our pilot as well. So our pilot was ran in 2021, and it was one of the largest pilots the CSO has ever conducted. During that time as well, we also, again, facilitated by Dublin Rape Crisis Centre, to engage with survivors of sexual violence, take a look at the full questionnaire and how they found the impact of it, how they found the length of it. And we're really, again, able to tease out the impact that this kind of questionnaire would have. So on the final point then for survey management, so this is how we would conduct the survey generally. We were kind of testing that at every stage. So through our focus group work, through our survivor review during the pilot, and the pilot itself, trying to tease out how we could capture this information as efficiently and effectively as possible. And as well as that, we had our ethics advisory group, who also took a look at, I suppose, our methodological process, particularly from that lens of our ethical responsibilities as well. So now I'm just going to touch on some of the concepts in the sexual violence survey. So this is, I'm going to go down through a lot of definitions here, and there'll be a lot of text on the slides, but I'm just going to pull out the main points for you so that you understand the concepts when you see them on Wednesday. So just, I suppose, to outline the first element, of the consent principle is used to gather people's experiences. So this underpins our legislation, and this is what we've used within our survey. So the age of consent is 17 in Ireland, and this is the cut-off point between adulthood and childhood experiences in our survey. So when we describe, an adult experience, that is something that occurred from the age of 17 and over, and for childhood experiences, that's from earliest memory up until your 17th birthday. So I suppose just to outline as well, as the age of consent is 17, for childhood experiences, consent really isn't an appropriate concept even to be applying to a childhood experience, as they're under the age of consent. So as you'll see in our material when we published that we have non-consensual sexual violence, and this is events that would have happened for adults, versus unwanted sexual violence as well, which is what we've used to describe the childhood experiences. Please note as well that for childhood sexual violence, we do include non-contact experiences within that definition. And just to be aware that this survey, it was asked of adults. So it was asked of people 18 and over. And the questions asked on child sexual violence, it was whether they experienced it in the past. So this survey will not provide insights on the current levels of child sexual violence in Ireland. So in terms of adult sexual violence, so as I noted already, these are experiences since the age of 17. It's broken down by partner and ex-partner, partner or ex-partner and non-partner. And again, I suppose reiterating that point that it is a prevalence survey, not an incident survey, that detailed questions for cases with multiple experiences will focus on the experience that affected the respondent the most. So these are kind of a breakdown of the questions that are included within the survey. But just, I suppose, for you to be aware that for adult sexual violence, we have about 4 categories. So we have non-consensual sexual touching. That's where someone's breasts or genitals were touched without their consent, or they were forced to touch someone else's without their consent. We have non-consensual sexual intercourse, where someone was coerced, threatened or forced in order to have sex, or where the person could not give consent or stop what was happening because the respondent was asleep, passed out, or under the influence of alcohol and or drugs. We also have non-consensual attempted sexual intercourse. So this is where intercourse was attempted, but it did not happen. And then we have a final category, which is non-consensual other sexual contact. And this is where any sexual contact was made where the person was again asleep, passed out, or under the influence of alcohol or drugs, or whether any other sexual contact was attempted. There's a lot within that. And just to touch on that point there, non-consensual sexual intercourse. So this is where a person has ever experienced as an adult with a person who coerced, threatened or forced them in order to make them have sex, or where they had sex where the respondent could not give consent or stop what was happening because they were asleep, passed out, or under the influence of alcohol or drugs. So this variable is based on the concept of consent, which underpins the criminal legislation on rape and sexual assault. And this is the wording will be used, as this is how the variable was collected. So I suppose just to reiterate on that point again, that because we're using this terminology, just to be aware that these are very sensitive issues, very sensitive concepts that we are describing. And people have trusted us in sharing their experiences with us. And we want to be sure that when people read this survey and see the data they provided to us, that they can see themselves within that data as well. So these are the reasons that we're using this terminology, non-consensual sexual intercourse, within the survey. So in terms of child sexual violence, so again, this is since earliest memories to their 17th birthday. It's broken down by contact and non-contact experiences, and it doesn't include similar age relationships which the person was comfortable with. And again, much like the adult experiences, as this is a prevalence survey, detailed questions for cases with multiple experiences focus on the experience that affected the respondent the most. And much like the adult sexual violence kind of concepts or variables, we have similar variables for the child sexual violence. So we have unwanted sexual non-contact. This is where someone, for example, asked or persuaded or made you look at pornographic material, or whether someone exposed themselves physically in a way that made you feel uncomfortable. We have unwanted sexual touching. This is where someone touched your body in a sexual way, or asked or persuaded or made you touch someone else's body in a sexual way. We have unwanted sexual intercourse. This is where you were persuaded, made or forced to have sexual intercourse. And then we have attempted unwanted sexual intercourse, where this was attempted but the intercourse did not take place. And then finally, unwanted other sexual contacts is non-specified sexual contact that someone attempted to make with you. So that's, I suppose, the adult and child. And then we're going to talk about lifetime sexual violence as well. So this is where if someone had experienced any sexual violence type across both adulthood and childhood. So it may have happened in adulthood alone, it may have happened in childhood alone, or it may have happened across both. And this is kind of an overarching variable which includes people who've experienced unwanted child sexual violence experiences listed there, sexual non-contact down to any other sexual contact, or person has experienced as an adult non-consensual sexual touching down to attempted sexual intercourse, and other sexual contact. And then finally, I'm just going to touch on the sexual harassment definition. So this, again, is quite a broad definition, and it's defined by unwanted behaviours that a person may have experienced in their daily life, which made the person feel offended, humiliated or intimidated. And this data was limited to the last 12 months. That's the information we were collecting on sexual harassment in their daily life. So we have a range of experiences there, from crude or sexually explicit remarks being made as a person found offensive, humiliating or intimidating, down to, for example, someone being exposed to sexually explicit pictures or photos that made the person feel offended, humiliated or intimidated, or any other inappropriate sexual advances that made the person, again, feel offended, humiliated or intimidated. So that's, I suppose, some of the overarching variables that are within the survey, from adult sexual violence, child sexual violence and sexual harassment. And now I'm going to hand over to my colleague, Dr. Jess Coyne, to go and talk about how the data was collected.
And thanks very much, Helen. Yeah, so I am going to take us down through the methodology behind the collection of the data. So we'll jump straight through it. I'm just going to give you a brief outline of the areas of the survey. We had a couple of different areas. We had socio-demographic details. We wanted to collect these are basically details about a person to create the full picture of the individual that may have responded to our survey. We had an area on, as Helen went down through the definitions there, on questions surrounding harassment and stalking. We had another group of questions asking about the overall experience of intimate partner violence, a separate section about non-intimate partner violence, and then we also had a section on child abuse, both non-contact and contact. And then finally, we had a block of questions on attitudes. So the flow of the questionnaire was very important when we were designing it, and we moved, I'll go into a bit more detail in the next slide, but we moved from kind of a less sensitive to more sensitive questions, and this is reflected in this slide here. So I suppose it's just a couple of key points there, the 3 bullet points. So it was key for us to use behaviourally specific questions. We wanted questions to be clearly worded and unambiguous. So direct question using non-accusatory language, basically the ethos for developing the questions, and this survey was not to victim blame. And obviously we focused on sexual violence experiences only. So just to describe the actual setup of the survey instrument itself, we had the introduction to the survey. It was at this point that the respondent was made acutely aware of the content of the survey, that it was about sexual violence. And also at this point, we gave them a couple of, I suppose, housekeeping elements as to, you know, that this was a voluntary survey. If you did not want to answer any question, you could just skip through it, that you could not return and view any of your previous answers, just bits and pieces of housekeeping like that. From there, then they were brought to a screen, and here they had to give explicit consent that they were happy to move into the survey. So there was just a couple of I suppose, information points here that we just wanted to make sure that whoever was agreeing to participate in the survey were aware of. And once they passed that screen, then it was into the socio-demographic questions. So these questions, as I mentioned previously, they were just questions around, age, sex, education level, industry and occupation, just to try and create a picture of the respondent that was interacting with us. So as I said, like the flow of the questionnaire was extremely important in the design. So we moved into the harassment and stalking. So we moved from almost a kind of a less sensitive area up to a more sensitive. So we started the questions surrounding sexual violence with the harassment and stalking. So each block, so your harassment and stalking, your adult experience, your childhood experiences, there was a standard number of questions for each block of questions that everyone answered. And it was based on the respondents' answer to these questions. If they had some form of experience of any of these in any of these areas, then they answered follow-up questions, just giving some detail around the experience. So we had, from the harassment and stalking, they moved into the adult experience, and this was experienced since they were 17 years of age, and this was broken down, as I previously mentioned, into intimate partner violence and non-intimate partner violence. And then when those two sections were completed, if somebody had experienced either of these two types, they were asked about disclosure experience, their experience of disclosing. We moved on then, and we had a similar plan for, or a similar structure for the childhood experience. This was experienced up until the age of 17, so from their earliest memory up until the age of 17, and we broke that down into non-contact and contact. And again, if somebody had experienced anything in either of those two areas, then we asked about their experience of disclosure. So at this point, we're at the most sensitive element of the questionnaire. We also had a block of questions on attitudes, so there was a number of statements and the person had to interact with them. This block of questions was only asked of individuals who had not disclosed that they had experienced any form of sexual violence throughout their life. And then we finally finished off the questionnaire instead of finishing almost on a cliff, we wanted to gradually bring the person back down. So we finished off with a respondent feedback module, and that was just to give the respondent a chance to interact with us, to let us know how they felt about using the survey instrument itself. So I'm going to go down through a couple of other bits and pieces surrounding the actual process of collecting the data. So the survey frame. So what is the survey frame? Just for those who aren't used to this sort of terminology. So the survey frame is just basically the source from which the respondents chosen to participate in this survey were selected from. So the CSO collects data for statistical purposes from a wide range of sources, and this data is known as administrative data. So our existing census was supplemented with this more up-to-date administrative data. So by doing this, we were able to create a frame of persons in Ireland to draw our sample for this survey from. There was a wide number of sources used, both from survey data collected directly by us in the Central Statistics Office, and also other statistical data sets that we received from public sector bodies. So that's just a bit of a background on the frame. So the survey sample, our survey sample was a stratified simple random sample. Again, what does this mean? Well, a simple random sample, a person was selected completely at random from our sample, and stratified is just, we just ensured that each population group was represented accurately in our sample. So basically that our sample was representative of sex, age, and around the country as well. So mode, what is our survey mode? So our mode is how we collect, it's essentially how we actually collect the data itself, right? And from all of the international research that's out there, it's well documented that mode for a survey, or a survey on a sensitive topic like this, is extremely important. So bearing that in mind, we offered a multi-mode approach for the sexual violence survey. And what we did was we offered 3 different ways to respond. The first was computer-assisted web interviewing, known as CAWI, and I'll go into more detail about how we use these different modes in the next slide. We used computer-assisted personal interviewing with computer-assisted self-interviewing elements, so that's known as CAPI-CASI, and then we also offered a pen and paper interview, a PAPI interview. So just an overview of the survey process itself and how we collected the data, and the multi-mode approach. So as with all data that we collect in the CSO, the respondents are the centre. It's where we start designing and building our instruments from. They're our main concern. And I suppose this survey, we wanted to give everyone the opportunity to respond in whatever way they felt comfortable, while obviously maintaining the highest standards of data confidentiality and anonymity that the CSO provides. So we set up the survey as follows. We had this person-based frame, so we had a person's name and address. And what we did was we sent them a letter, and this was our first interaction with our respondent, and this was the first way that we invited them to participate here. So what was in the envelope that we sent? So inside in the envelope, there was a letter of invitation. On that letter of invitation, there was a brief introduction or about the survey. There was a link that brought them directly to the survey instrument itself. There was also their single-use access code to gain entry to the survey. And there was a link of frequently asked questions and also all contact details for phone support and email support that were being provided by the office on the letter itself. Inside in the envelope with the letter, we also had a leaflet explaining to the participant why it was so important to take part in this survey in particular. And we also provided a helpline leaflet, and this had a list of all of the helplines available for anyone that may have been affected by what was contained in the letter, and that was done on a county level. So this was the first interaction. Generally, we gave about 7 days, and we sent our respondent a reminder letter, because obviously everyday life people have the best of intentions of participating or helping, responding to somebody, and we just forget or we lose the letter. So we sent a reminder email about 7 days after the initial email, and then we distributed our cases to our interviewer. So the very first mode that we wanted the respondent to engage with was online, so that CAWI, that computer-assisted web interview. So once the cases have been sent to our interviewers, our interviewer role generally is they go out, they interview someone, they ask them all the questions, and we collect the data that way. So the interviewer role for this survey itself was just a small bit different. As opposed to interviewing, we wanted them to facilitate our respondent to fill out the survey themselves. So our interviewer called to the door, asked to speak to the specific individual that had been selected to participate, and basically offered them help. Just made sure that they had their letter, that they had their link and their single-use access code, and just, I suppose, reminded them that we would really appreciate if they could fill out the survey online. That wasn't always possible, be it the person didn't have internet access to access the web survey, or they didn't have a device to do so. So we provided our interviewers with tablets on which there was surveys loaded, so that they could offer the respondent the tablet to self-complete there and then. And then they also had a paper survey available if the person wanted to participate but could not use the CAWI version or the Kapikazi for on the tablet. So as you can see, the interaction there for the 3 modes. So just a small bit of information on what we provided for our respondents. So there was a huge amount of literature and communication provided to them. We had frequently asked questions available on our website. We had web information link for our responders, and this had more frequently asked questions contained specifically for people who had been selected to respond. We had information leaflets. As I mentioned, the why take part. We also had the helpline leaflets, and each of our interviewers had helpline leaflets that they had on hand if they felt that they needed to leave with the respondent, or if the respondent asked for them. And what we also provided was a dedicated phone support and email support in the office. My last slide, just about encouraging participation in the survey. So there was a huge amount of focus on this and on encouraging people to take part. So our main message for this survey was that this survey is for everyone and the answers are completely confidential. And what we meant by is for everyone is that it was for people who had experienced sexual violence in their lifetime and also for people who had not. And we felt this was a really important message to get everyone who had been selected to respond to interact with us. Another element that helped encourage participation, what we found was the letter directly addressed to the respondent. It created that link straight away with the person, and we felt anyway that it helped get the person engaged and to respond to us. The reminder letters helped, as I already said. We all have the best of intentions and everyday life gets in the way, but the reminder letters definitely helped to encourage participation, especially when we gave that short-ish period of time and gave them a chance to respond. And then our mode choice, having the multi-mode element, offering people a mode, whichever mode they felt most comfortable to respond to us, we felt also encouraged participation in the survey, and having the 3 different modes covered inclusivity and just getting everyone involved and respondents interacting with us. And I'm just going to pass back over to my colleague Helen.
Thanks, Jess. So I'm just going to talk now about considerations of comparability. So we've talked already about, the background to the survey. We've talked about some of the definitions, some of the kind of key elements you need to have in place when you're thinking about it. And Jess obviously gone down through how we collected the data. So on Wednesday, when you receive and see the data first, I just want to make you aware that when you see it, your most natural inclination would be to compare it, and just to be aware that when we're comparing, we need to be very aware of, I suppose, certain elements for these surveys. So just in terms of the framing of surveys can have a potential impact on data. So, data can be collected in a standalone survey like we did, which was a single topic survey, or it can be combined into other surveys on crime, where you're immediately thinking of something that's happened to you, it's something's been stolen, your house has been broken into, next thing you're asked questions about sexual violence. You can be included in health surveys. They can also be included in kind of broader violence against women surveys or other interpersonal surveys or interpersonal violence surveys as well. So how a survey is introduced can have an impact on the data that comes back. So please be aware that if you're comparing the sexual violence survey data to other different survey data, that you're aware of, I suppose, of that difference that can have an impact on the data that comes back. As well, the definition of the concepts and the variables within the survey can also have an impact. So across countries, you have very different legal definitions of what these types of experiences are, and also their objectives for the survey can be different as well. So I suppose in particular, the understanding of rape can change between countries and also across time as well. So, just to be aware that, some countries may not have made marital rape illegal. That only happened in the 1990s in Ireland, so it's just to be aware that different concepts can have an impact on the data that you're comparing it to. Also, the methodologies used to collect that data as well can be different, and that can have an impact as well. So whether it's interviewer-led in terms of telephone or a face-to-face interview versus self-completion, which is what we try to maintain across our 3 modes, whether it's web, whether it's paper, these can all have an impact on the disclosure rates within the survey and hence the eventual prevalence rates as well. Also, differences in frame definitions and, sampling methodologies can also have an impact as well. It's just to be aware of that. Again, time definitions of the period across which the data is collected, the age of consent differences between countries as well. These can all have an impact on the eventual prevalence data that's published. So again, to be very, very aware of that. Our instruments, now Jess has obviously described our instrument in terms of how the flow of the questionnaire was, how we kept the attitudes towards the end of the questionnaire, and, you know, to be aware that where questions are placed can have an impact on prevalence levels. And a recent US survey had seen this very impact in their most recent survey in 2015-2016. And also a point I'd raised and mentioned previously about societal differences. So society's acceptance of violence generally in their community and the awareness of the problem can have an impact on people's disclosure rates as well in the survey. People may not feel comfortable in identifying their experiences as part of the spectrum in a society that might be more closed or less likely to acknowledge that this happens compared to societies who may have a lot of work in generating awareness, people, you know, societies that are more aware that this is an issue for people. So again, just to be aware of that when you are comparing data between countries and between different time periods as well. So look, I'm just going to sum up now just to, I suppose, underline some of the choices that we made to ensure, I suppose, the high quality output that we'll be publishing on Wednesday. So we went with this as a single topic survey. This is not a module in any of the survey. It's not combined with anything else. So single topic survey to meet, I suppose, ethical kind of responsibilities, but also to improve the quality of the data that we were collecting as well. So we went with a person-based approach rather than a household approach, limiting any risks to persons' safety and to, again, improve the data collection process and improve the eventual quality of the data that we received. We went with self-completion and we removed the interviewer from those interactions, particularly on the sensitive questions being asked. Again, trying to improve the data quality, trying to improve the data that we had received. We had we had our options in terms of whether going for a single mode or many modes, and we went for several modes. So you could go online, you could answer it on paper, or you could answer it on a tablet facilitated by an interviewer. This is trying to get as broad a cross-section as possible of people to engage with the survey, and again, that will speak to the data quality eventually. We did put a lot of work into the refinement of the data point list so that not all of the data points outlined by the scoping group report are included within this, but we made clear decisions shared with the stakeholder community to try and operationalise this so that we would come to this point where we actually had high quality data to publish. And then again, just reminding you on the wording of the questions that we use behaviourally specific questions, and that I suppose consent is a concept we use within the survey rather than only force. So this will represent on Wednesday when we publish a new baseline of information. We'll now be able to talk of population prevalence. This will be a nationally representative figure. This was our aim when we started off this project. We'll have used best practice in questionnaire design for sensitive topics. We've really focused on trying to reduce underreporting where possible at each stage of the process. And we really felt self-completion was important for collecting data on sensitive topics. We had good governance of the ethical conduct of the survey, that no ethical issues were reported during the field collection. So we had, I suppose, as I mentioned already, a multi-mode survey getting a broad cross-section of the population. Our response rate that we received compared very well with other international surveys. And this survey meets this national need. And we've had a lot of collaboration with the sector, particularly from the Liaison Group Forum. So again, just to remind you that there's always a risk when you're balancing under and over reporting in a sensitive survey like this. As I mentioned already, the scale generally tips to under reporting, and we've tried where possible to limit that as much as we can. Be aware that when we publish, particularly in the more detailed sections, certain demographic cohorts will have to be grouped in order to publish information on the variable. So as part of, I suppose, the label of official statistics, there are certain quality metrics I need to meet. So I need to have a certain number of observations per cell. So some cohorts may have to be grouped. We'll see that as we move through the publication cycle. And then just again to remember that comparability is challenging for this type of data, given differences in mode, differences in concepts, difference in questionnaire flows, different awareness levels of the issues across societies, and making it very challenging for comparing both national, international, and across time. So overall, we've built up a lot of expertise in the office on how to design and collect and disseminate such surveys that will put us in good standing when we're developing further surveys on these topics. We had one of the largest pilots the CSO has ever conducted for the survey, and we incorporated those learnings into the main survey design. So this data was collected in 2022 from May to December. As I mentioned already, we had no ethical issues, with a strong response rate, and as I say, a lot of decision points and work completed but couldn't have been done without the support of the Department of Justice and also the stakeholder and NGO community. So now I'm just going to touch on the publication schedule. So just to let you know what's coming and when it's coming. So our reports are mainly descriptive statistics, not going to include an analysis of relationship between the variables, but in all we have about 90 tables which will be published across 6 publications. So we have the main results which are coming out on Wednesday. We'll have an adult experiences publication, childhood experiences publication, one on disclosure, so whether you told who you did, how long it took, a separate report on harassment, and then a final one then on the attitudes. So just to outline what we're going to have in the main results on Wednesday, it will contain information by sex and age and overall prevalence levels for lifetime adulthood and childhood experiences. It'll break down those experiences in contact and non-contact into partner and non-partner, and it'll talk about the overlap between those experiences as well. It'll also include data on the relationship between the parties and whether the person disclosed their experience of sexual violence to anyone. So on the 19th of April, we'll have a press conference at 11 o'clock and our documentation and tables will be available on the website at that time. We'll have a press conference, which will be, you'll be able to attend virtually, which will focus on the presentation using data from the main results, followed by a questions and answers session. And just to outline just a little bit more on the timeline for the subsequent publications, our adult experiences is going to go out on the 9th of May, and this will include information on partner and non-partner experiences. It'll also contain information on the socio-demographic, additional socio-demographic information as well. It'll include data on the frequency of experiences, who was involved, the duration of the experience, and the location of the sexual violence experience as well. For childhood experiences, it'll be published in May or June. Information will be on contact and non-contact experiences, and much like the adult experiences will contain additional socio-demographic information. It'll look at the frequency of experiences, who was involved, the duration and location of the experience, and the respondent's view on why it stopped. In June, we'll publish a publication on the disclosure. So this will be looking at information broken about adult and childhood experiences, who was told, how long it took to do so, the reasons why the person disclosed, whether they disclosed to the Gardaí, if they used any other services. Then in probably towards the end of June, or the start of July, we will have a publication on harassment, and this will include information on sexual harassment that occurred in the last 12 months. And again, like previous ones, it will include information on the frequency of experiences, who was involved, what happened within that. But again, just to reiterate, that will be based on what occurred in the last 12 months. And then the final publication in July will be based on attitudes, and this is information from those who did not disclose sexual harassment or violence in the survey. It'll then sum up kind of public opinion and so-called rape myths and the perception of the frequency of sexual violence in the community as well. So that's a whistle-stop tour of everything today. I could spend 4 or 5 days talking to you about all the intricacies, but we're just trying to give you some tools just so that when the publication comes out on Wednesday, you're going to be able to engage with the data immediately. So I'm just going to hand back now to Keith.
Okay, Helen, thanks for that. And thanks to Jess also for a very comprehensive overview of a very complex area. I think it's fair to say that. So